Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 48-year-old patient who reports a diagnosis of obsessive-compulsive disorder has transferred to your care after moving from out of state. You are unable to obtain medical records and must rely on the patient for information. During the initial appointment, the patient reports a very stressful home life. She has a school-aged daughter with severe chronic illness who requires 24/7 total care, as well as some other stressors related to her other children and finances. The patient says that for several years she has been in exposure response therapy with intermittent, inconsistent improvement and took fluvoxamine 300 milligrams daily, which seemed to help for a while but then stopped. Her primary symptom presentation is related to obsessive thoughts, although there is a strong chronic anxiety and depressive component. The obsessive thought patterns are markedly worse when there is a stressful life event, and she has had periods of relief when things are calmer at home. Which of the following aspects of her history is a favorable prognostic indicator? So there is quite the background story here, but the question is really very straightforward. Which of the following aspects of her history is a favorable prognostic indicator? You know, in the world of obsessive-compulsive disorders, it exists on a spectrum, I guess, like every other mental health diagnosis, and there are some circumstances in which the outcome, the prognosis is really very positive because there are several favorable indicators. And then there are other circumstances where not so much so. So this question, despite the fact that there's quite a bit of background given here, the bottom line is it's asking you which of the following aspects of her history is a favorable prognostic indicator. And I emphasize this only because sometimes when the question does have, a few sentences, it does have some background to it, it's easy to find your brain going off into these various tangents and directions, and you just start, thinking about different directions, and you have to rein yourself in back to make sure you focus on exactly what the question is asking you. Which of the following aspects of her history is a favorable prognostic indicator? A, precipitating triggers. B, reported history of treatment. C, presence of children in the home. Or D, lack of comorbid convulsions. And given that the question is, which of the following aspects of her history is a favorable prognostic indicator, the correct answer is A, precipitating triggers. It is clear that her obsessive symptoms worsen in the presence of triggers, and this is a favorable prognostic indicator. In fact, there are a number of favorable prognostic indicators when it comes to obsessive-compulsive disorders, and that's one of them, the fact that it is triggered by some particular thing, that there's a trigger. The ability to adapt to environment is another one. The episodic nature rather than a chronic persistent nature is a positive prognostic indicator. So there are several, and from among these four answer choices, it's A. The reported history of treatment is really not an indicator either favorable or unfavorable. I mean, we know her history. She's been in exposure response therapy. She's taken fluvoxamine. It seemed to work, and then it seemed to be not so helpful. It's certainly helpful to know that history going forward with respect to her plan of care, but in and of itself, it is neither favorable nor unfavorable in terms of prognoses. Similarly, C, children in the home. This is not a prognostic indicator. Now, presence of children in the home is considered a protective factor in suicide assessment. So if you're trying to put a bunch of things together in your brain as you prepare for your boards, it's easy to start mixing and matching some things, but don't let yourself do that. Remember, each condition, each diagnosis has its own factors. So in the setting of OCD, and prognosis, children in the home really is not relevant. Like I said, with respect to suicide assessment, children in the home is considered a protective factor, but it really isn't relative to the prognostic assessment of OCD. And D is not correct. The absence of compulsions in its own right is not a favorable prognostic indicator for treating obsessions. Obsessions can be just as debilitating, just as chronic, just as deteriorating, just as intrusive as compulsion. So it's not a matter of, if the patient doesn't have compulsions, it'll be easier to treat the obsessions. That's not a fair assessment. Obsessive-compulsive disorder as a diagnosis may be characterized either by obsessions, compulsions, or both. But all three of those circumstances can be equally challenging to treat, and the absence of one doesn't make the other any more manageable. So again, when we're talking about OCD, there are favorable prognostic indicators, and then there are poor prognostic indicators. Predictors of a favorable prognosis are things like social and occupational adaptability, the ability to actually adapt to a particular certain circumstance, the presence of a precipitating event. If the obsessions and or compulsions get worse in response to a trigger, that's actually has a better prognosis than someone whose symptoms are just chronically present, whether or not there is a trigger. Same thing with the episodic nature. On, off is more favorable than someone who is just basically always on. On the flip side, by the way, the poor prognostic indicators are those that have an earlier onset in the lifespan, like starting in childhood, where the compulsions are really bizarre. Typical compulsions typically are around cleanliness and safety, hand washing, washing of the genitalia, persistent bathing, clean, sheets, clothes, things like that, and checking safety, like turning off the stove, locking the door, things like that. Bizarre compulsions tend to have a poorer prognosis. Obviously someone whose obsessive compulsive disorder actually results in delusional thought is a poor prognostic indicator. And anyone who needs hospitalization, logically, that's a poor prognostic indicator.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.